Oh, what happened?
Sorry.
You took a nap?
Goodbye.
Sarah.
Okay, I have 23 people. Who is absent? Because me and Dr. Kudia doesn't count. There's only 21.
I was eating a sandwich.
So I still don't see. Tenzing. Marcel's here, right? Yeah, Yaha's here. Paula. How about Kanisha? Kanisha's here. Mercy. Siko here? Yes, Siko.
Yes.
Jordan. Mariah. Sonia. Sakira. Dejindra.
Professor, you didn't call my name.
Well, I saw you up here, Brittany.
Oh, sorry. I'm sorry.
Yeah, and I see Angela, Ariel. Missing.
I'm here.
Here.
I'm here, Professor.
Who are you?
Perk.
What?
Perk. And Perk.
Oh yeah, I saw Jen Perk.
I'm here.
All right, I'll figure it out. I'll look at it during the break. Okay. So we know about vaccination. We are experts now. This is your prevention. This is your patient education. Avoid crowded places. By the way, for your quiz 3, whenever that is, will be on TB and pneumonia. Okay, so you have, I mean, these are very, self-explanatory. I'll let you read that. Let's go now to signs and symptoms. All right. What will a patient with pneumonia show?
Who's ever there's yelling in the background,
Chest.
please.
Chest pain.
Okay, for
That dyspnea, though.
take note
Okay.
that they won't all appear at once. Okay, the elderly, for instance, may not show all of these symptoms. One of the manifestations for the elderly might simply be change in mental status. Okay, which is a evidence of hypoxia. All right, so you need to be more vigilant about watching your patient. As the condition progresses, you'll start hearing crackles. This is now fluid buildup in your lungs. As well as the inflammation advances, it will now reach your upper airway, causing wheezing. And of course, the hypoxia, this one, as it progresses now, this is now the condition has advanced, and the patient may now be nearing sepsis stage. This is a summary of your common signs and symptoms, table 31-3. And let's go now to labs. All right, we don't always get a sputum because the patient may not have productive cough at the time of admission. Again, our core measure is we have to start the antibiotics. So whether or not we get a sputum culture, we have to get the antibiotic started. It would be nice if we get a sputum culture. This is the equipment you'll use in order to acquire the specimen. So this one you attach the suction, and then you put this in the patient's throat, and hopefully you can get a sample. But again, it should not delay antibiotic administration. Okay, you can't really wait for the sputum culture. Again, that would be ideal, but it must not delay antibiotic administration. X-ray can already give you a differential diagnosis. If you see again density, because the lungs should be air filled, X-ray will show either increased density or infiltrates. Infiltrates is now the presence of fluid in the lobes of the lungs. So it may involve a segment, a lobe in one or both lungs. So this is what I mean by the in the older adult, the X-ray may be your only evidence because the patient's symptoms may not be the ones listed here. The elderly may not show all these symptoms listed in table 31-3. Treatment. Treatment, of course, is antibiotics. And on top of antibiotics, is it any different from what we saw in chapter 30 under COPD? Namely, do we give oxygen?
Yes.
Do we have them use the incentive spirometer?
Yes.
Do we have humidification?
Yes.
Breathing. Do we suction as needed?
Yes.
All right. So all of those interventions are still going to be applied. Will these patients receive bronchodilators?
Yes.
Yes. So I won't repeat that. They repeated this here, but I won't repeat everything. So the patient is still having a respiratory condition. So therefore, it's the same interventions as you saw in under COPD. Okay. On top of that, though, because the patient now has that tendency for sepsis, then you monitor the patient for these for signs and symptoms of a systemic infection. Namely, you look at your vital signs, specifically the blood pressure. Again, sepsis will be discussed later in chapter 32, so I won't. Yeah, wait a minute, sepsis. No, sorry, sepsis is chapter 37. But again, that's another day and semester, so we'll skip that for now. Majority of your interventions, of course, it's going to be antibiotic therapy. That's the most important. If they have a pus formation, they may occur in pockets. If they're large enough, the doctor will drain that pus. Okay, we have 10 minutes and then we'll go on a break. Home management. So it's very important because we won't keep the patient in the hospital the whole time to heal the pneumonia. Okay, so there will be the average length of stay is about 3 days. So they'll be sent home after maybe 3 doses of IV antibiotics, and then they'll continue treatment at home using PO antibiotics. So it's very important that you teach them these details here at discharge. Very important is completing the antibiotic therapy. Tell them what to report if these things develop, okay, at home. They should gradually increase activity when they get home because their lungs aren't fully recovered yet. So it needs time, okay, to recover from the infection. And we don't want any other infection. Remember, how did they get pneumonia? Did they have factors to begin with? Yes.
You said that they have what?
Risk factors to begin with, how they got pneumonia?
Yes.
Yes, obviously. So
Yes.
they avoid those other risk factors because maybe they got the pneumonia because they were in a crowded place, just like COVID-19. So avoid irritants, and also, good nutrition, pulmonary hygiene, which is turning, coughing, deep breathing. And that's it. We'll continue with TB after the break. I'll see you back at 15 after.
Okay.
All right, sounds good.
Should we leave the chat and then come back, or what?
Yes, I'll end the meeting.
Professor, it's 9:03, so you mean 9:18?
No, 9:15.
Okay, bye. Love you. Good night.